Hey there, how are you? Dr. Erickson, EHS Physical Therapy and Chiropractic.
And Dr. Jake Anderson with Essential Motion.
So recently came across a question, and it's a very good question because we don't always explain this very well. We take it for granted that when someone has a TENS unit or some kind of superficial modality like a TENS unit, where do I put it? So when I have let's just say it's either a neck, an issue with arm pain, or a low back issue with leg pain, sometimes you feel it more in the more distal area, right? I feel it more in my hamstring or my calf, or I feel it more in my tricep and arm as opposed to that source. So then the question is, do I put the TENS unit at the source, at the origin of the pain and the disc issue, or do I put it where I feel it more in the leg or the arm?
Yeah, and the answer here is the tool is just used to modulate your sensation of pain. So it's not really going to solve the underlying issue. All it's going to do is open up a window of pain relief to where you can move better. So there's no right or wrong answer in this scenario. You can put it on the leg if that's where you feel the most intense symptoms and see if that gives you enough relief to start working into other movements or other exercises that will make more of a change in the end. If the pain is central to the low back, you might get more relief placing it on the low back, which will open you up to further ranges of motion and again, help to get you more active and able to do the movements or exercises that you need to be doing.
Yeah. So I grabbed one here. We happen to have a TENS unit here, and they can be, quite useful for an acute increase in pain. But again, you get to realize it's just a superficial modality. It's not going to change the disc issue deep down. It's not going to change the actual, injury or thing causing the pain. It just hijacks that pain signal, makes your brain kind of interpret the buzzy feeling of the machine as opposed to the nerve pain that's just like constantly going up that highway to your brain. So if it like Jake said, if it allows you to do more movements or it allows you to kind of calm those things down to where it gets you up and able to move, that's where the benefit's going to come from is the actual activity and movement, not purely from this. But let's just say we're going to put it on the back. So if you had this couple of, here's the pads. The pads look like that right there.
Yep.
Here's a pretty typical TENS machine. It usually has 2 channels,
Yep.
and there's usually 2 leads per channel, so there's 4. And so typically what I would do is I would take them and I would just cross them. I'm just going to take this off here to kind of show.
So you can think of the effects of the TENS machine as like if you bump your knee up against a table and you start rubbing your knee, how that makes you feel better.
Yeah, there's a mechanical response. So if we know that the pain is off to the right here, I would probably round up or circle around in an X pattern that area. It could be here, it could be here. Like Jake said, it doesn't matter, but I would go in an X type pattern. So I'd put one there, one there, one there, and one there, right? So now I got those 4 pads hanging off, and then my leads would go opposite. So I'd take channel 1, and I'd go upper right here to lower left. So channel 1 looks like this. Okay, channel 1's like that. Then I'd take channel 2, and I'd go upper left to lower right. So then the machine is going to send the pain signal from, or the modality of the TENS unit this way on one channel and this way on one channel, and where that X kind of meets, that's right over top that painful area. So it even could be here. It could go here, 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 here. Again, I'm going to go upper right, lower left, upper left, lower right. We're going to cross those so that the energy is placed right on that one spot.
Yeah. So this is a great tool. These are pretty inexpensive. If you look on Amazon, they're probably, 20, 30, 40 bucks, somewhere in there. Pretty reasonable. Yeah, so this is a tool that you can use at home, pretty low risk, and especially if you're trying to avoid any, hard medications or anything, or if you're just looking for that little bit of relief throughout the day. This is something that you can work into your at-home routine to get you more active and keep you mobile and just kind of keep that pain at bay so you can continue to do the things you love.
Yep. So like I said, if you use it, get up, get active, walk around, or even maybe you have to, if the movement for you is something on the floor, whether you're bending forward or extending backwards or moving your hips or whatever it is that you need to do, you can use it to facilitate the movement and exercise. Don't use it as a standalone thing and say, well, this is my treatment to fix this. It's just to help you to facilitate, as a facilitator.
Use it as a tool, not a solution. All right, we'll catch you on the next one.